Hi, Dr. Reed. So this is my presentation. It's on the acquired immune deficiency syndrome, most commonly known as AIDS. So I just want to start off by saying, what is AIDS? AIDS is a syndrome caused by the HIV virus. The HIV virus gets worse and worse and worse, and the last stage of HIV turns to AIDS. So it's commonly known as the advanced HIV infection. So it's when the immune system is too weak to fight off any infection, and it could develop into other health problems such as pneumonia, thrush, fungal infections, TB, all that bad stuff. And it's also increased risk of developing life-limiting conditions such as cancer and brain illnesses. So how do you get AIDS? You start with HIV, like I said, which is the human immunodeficiency virus. It is found in bodily fluids such as vaginal, anal, semen, fluids, all that kind of stuff. So there's also a risk in infected needles and syringes. That's why they always say, don't share needles, don't share syringes, the doctors wear gloves, so you can't transmit any of these syndromes. So it takes 10 to 15 years to develop AIDS. HIV goes on and on and on. It gets worse and worse and worse, breaks down your immune system, and then it turns to AIDS. So it's not just you get AIDS from sharing a needle. It's you get HIV, worsens, develops into AIDS. So AIDS actually is really bad because it's getting worse and worse over time. And like I said, HIV has severely damaged your immune system to the point of no return. And diagnosis is determined by a blood test. So you go in, you get your blood taken, they analyze it, test it, all that kind of stuff, and you get diagnosed with HIV, and then it goes into AIDS. So there's no cure for HIV or AIDS. So once you get HIV, got it for life, and it can slowly go into AIDS, and then once you have AIDS, got it for life. You can't go back into HIV. You have both for the rest of your life. So they're not curable, but they are manageable. So some signs and symptoms of HIV and AIDS. I actually included HIV in here because HIV goes into AIDS, and some of these symptoms go hand in hand. So I want to include both so you could see what the signs and symptoms are for both. So for HIV, fever, chills, rashes, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers are the signs and symptoms. And actually for AIDS, some of these are the same. They're actually worsened. So you can see that they go hand in hand, kind of. So the first sign and symptom of AIDS is rapid weight loss. So rapid weight loss you see in movies when they get all skinny, they deteriorate, they lose all their body mass. That is the most noticeable sign of AIDS, is the rapid weight loss. And then reoccurring fever, extreme tiredness, prolonged swelling of the lymph glands, which goes hand in hand with HIV, prolonged diarrhea, sores in the mouth and genitalia, pneumonia, memory loss, depression, and then you get these red, brown, pinkish, purplish blotches on or under your skin, and they're inside your mouth, nose, eyelids. They honestly are everywhere. They can get in your arms, stomach, legs, and they're very prominent and very noticeable. So it doesn't just look like a birthmark or anything. They're very dark, very noticeable, so that's an indication of AIDS. Also, a CD4 count below 200 cells per millimeter of blood is a very good indicator of AIDS as well. So I just mentioned a CD4 count. What is a CD4 count? It is a lab test that measures CD4 T lymphocytes in a sample of blood, and it determines how well your immune system is working. These CD4 cells are a type of white blood cells, which we've learned about in anatomy, biology, and these white blood cells actually identify invaders in the body and kill them. So they prevent the body from getting infections, diseases, that kind of stuff. And they play a role in protecting the body from infection, like I just said. So they send signals to the body's immune response, which detects the invaders like the viruses and bacteria. So once a person is infected with HIV, the virus begins to attack and kill these CD4 cells, which is not a good thing because these CD4 cells basically identify these infections that are in the body and destroy them. And without these, the infections can spread. So CD4 cells of a healthy person range from 500 to 1200 cells per millimeter of blood. And like I said in the previous signs and symptoms slide, these levels decrease to as low as 200 cells per millimeter in someone with AIDS, which is a very good indicator of AIDS. So you would go back, get a blood test, and they would determine from your HIV if your CD4 cells or if your CD4 level has gone down enough to indicate that you had AIDS. So some effects of AIDS on the exercise response. So excessive water loss from the body, causing dehydration. So in someone with AIDS, they lose water very easily. They sweat very easily, which is very important because they need water to live. So they need to keep their hydration up so they can exercise. Because when you exercise, you lose even more water, and we don't want them to lose water. We don't want them to be hydrated. So we want them to drink a lot of water before, after, and during exercise. Injuries may take more time to heal. So if someone gets a cut or sprains an ankle, this will take more time to heal because their immune system is so low that it's delayed, it takes more time, stuff like that. So they want more time to heal. Loss of lean body mass. So like I said, the rapid weight loss, they have no muscle basically. Their bone density has gone down, so their loss of body mass, lean body mass, has gone up a lot. They're losing all that body mass, so it's going to make it harder for them to exercise. Injury can be caused by the wrong form. So since their muscles are weak and their bone density is low, say if someone squats and they squat with the wrong form, since their muscles are weak and the bone density is low, then the form may cause them to get an injury more quickly. They may mess up their knee, their ankle, their quad, something like that, that would cause them to be done with exercise for a while because they're so weak. So you want to start them out slow, progress them into it. Don't jump anything on them too quickly because of the aids. And exercise can help the immune system work more efficiently. So that's why we want to exercise, because we want that immune system to work correctly and keep going so they don't die. Management and meds. So there are various different types of meds that are all a mouthful to say for people to take who have AIDS. So most of them you'll see are things that are enzymes in which the HIV needs to copy itself. So basically, we don't want this infection to spread. We want to keep the HIV manageable because we can't cure it. We want to keep the HIV and AIDS manageable so it doesn't spread and get worse. So the first med is a nucleoside reverse transcriptase inhibitor, and it blocks the reverse transcriptase, which is an enzyme in which HIV needs to copy itself. And then there's non-nucleoside reverse transcriptase inhibitors, and these bind to and alter the reverse transcriptase. Then there's protease inhibitors, and these block HIV protease, and it's an enzyme which HIV needs to copy itself. Again, we don't want it to spread. So more meds are fusion, entry, and integrase inhibitors. The fusion inhibitor blocks HIV from entering the CD4 cells. So once the HIV enters the CD4 cells, it can kill them, and there's less in the body, and that can aid in the infection spread. So the fusion cells block the HIV from entering those cells to kill them. The entry inhibitors block proteins on the CD4 cells, and proteins on the CD4 cells allow the HIV to get in, because everything uses the protein to get into cells, like we've learned in biology. So the entry cells block the proteins on these CD4 cells so that HIV can't get into these cells, because the HIV needs the proteins to get into the cells. Integrase inhibitors, they block the HIV integrase, which HIV needs to copy itself, so we don't want that, of course. And then pharmacokinetic enhancers. These increase the effectiveness of HIV medications. So you would take these with any of the medications that I just said to enhance the effectiveness of the medication. And then there's combination HIV medicines. So like I just said, you take 2 or more and of these medicines from 1 or more drug classes. So I did my case study out of a book. We actually have the book, but I found it online in Google Books. So I took it out of there. It's actually a legit case study in there. So I took it out of there and then kind of did my own spin on it and examined the risks and stuff on my own, because it didn't say that in there. So it was a male, 42 years old. His height was 5'10". His weight was 170 pounds, BMI of 24.38, resting heart rate of 72, resting blood pressure of 146/98. So looking at that data, I analyzed it and realized that his resting blood pressure is considered a risk. He's hypertensive. So that is definitely a risk, but since that was the only risk that was stated, it makes him a low risk category. So he's not too bad. He could be a lot worse, but he's doing okay right now. The client must obtain medical clearance before exercise due to his syndrome. So since AIDS has to do with infection, acute infection is an absolute contradiction. So if these people have infections that they don't know about, they definitely need to get checked out before they exercise, so that we as exercise prescriptionists know that they have infection and they will not be able to exercise. So they definitely want to get medical clearance before they exercise. And then the goals of this client is to improve cardiovascular endurance, muscle strength and endurance, improve range of motion, and improve overall quality of life. So for exercise testing, a graded exercise test is definitely recommended for this client. Since he's hypertensive and that's the only risk, he could definitely do a little bit of a harder graded exercise test like the Bruce protocol or like ergometer to test his cardiovascular endurance. 1RM test can definitely be performed depending on the client's other diseases that he has developed. So a bench press or a squat is good for this 1RM test. So because it's upper and lower body, test the whole body. Also, if the client has osteonecrosis, which it didn't say that he had in the book, but resistance training is a contradiction. Also, peripheral neuropathy may affect coordination. It didn't say he had it in the book, but if he does, caution is advised with weight-bearing activity because he could fall over, he could drop a weight on himself, anything that could harm himself with balance, coordination. That's not good for him. So definitely need supervision for that. So some exercise contradictions. Contradictions are determined by the other diseases that have developed from AIDS. Infectious diseases. Example would be if the client has chronic pneumonia, a contradiction would be a flare-up of unstable angina. Absolute contradiction, no exercise. Another example would be if the client has developed an acute infection, they also cannot exercise, like I said. But it always depends on what has developed from the different diseases, from AIDS and stuff like that. So it's not just a set of contradictions. It's what diseases have developed that causes contradictions. Except infection is definitely a big one because AIDS is a weakening of the immune system, which causes infection. So infection is definitely one of the more prominent contradictions. For exercise prescription, I decided to have this guy do aerobic training, walking, biking, sports, anything that he finds fun that is cardiovascular fitness. So I would start him moderate, 20 to 30 minutes a day, 2 to 3 days a week, and I would work up to 45 to 60 minutes, 3 to 5 days a week, anywhere from 40 to 60% of his heart rate reserve, depending on his fatigue level. So I put an asterisk here just because it is very important that it may be difficult to have a continuous training program due to fatigue or pain in the feet. So a sign and symptom of HIV and AIDS is fatigue. Fatigue can definitely cause problems with exercise. They definitely need to rest. You might not be able to exercise them for the rest of the day if their fatigue gets really heavy. Also, weak muscles, bone density is low, pain in the feet is very common. If there's hard stress on running, biking, anything like that, pain in the feet can definitely be a problem. So you would definitely want to rest the person. So also I would have this guy do resistance training. Resistance training is very important with someone who has AIDS. They lose all their body weight, they lose their muscle, their bone density is low, and resistance training can improve that. So it is the best way to improve that actually. I would do machines, free weights, bands, anything to improve bone density and muscle strength and give him resistance. So I would do 2 to 3 days a week, 80% of his 10 RM or 60% of his 1 RM. 2 to 4 sets of 10 exercises working on large muscle groups. So you want to do his whole body, not just upper body, not just lower body, definitely a total body to get his muscle mass back up. Continuing on exercise prescription, flexibility is important. So he loses his range of motion. His muscles are weak. He definitely wants to get that back. So muscle pain in the joints can be developed in someone with AIDS. So improving flexibility is important, like I just said. So yoga, static stretching, anything like that to get the muscles loosened up. 3 to 5 days a week, 30 seconds, hold per stretch. And he wants to do it to slight discomfort, not harsh discomfort. And it will probably be a lot less than a normal person because of that pain in the joints and less range of motion. So you want to start them out definitely light and then progressively improve with the flexibility. Maybe hold the stretches for longer or increase the range of motion that you're doing, stuff like that to improve his muscle laxity. So in conclusion, although AIDS is not curable, exercise can definitely improve a person's immune system. Like I said, exercise is medicine, always. Remember, at the bottom, exercise is medicine. So exercise can improve the immune system and keep it under control. So AIDS is manageable. So if you exercise, you can manage your AIDS. Take your medicine, you can manage your AIDS. You can't cure it though. But the more you exercise, the more your immune system will strengthen, it's under control, and it can help prevent a person from developing future life-threatening diseases. And here are my references. Thanks for listening.